often women leave and feel like they haven't even asked the question they went there for. Or if they've mentioned one thing, it's been shut down and the conversation's redirected. What I hope is it actually highlights to the doctor, oh, this is what really matters to her. Yes, I'm going to take my own history. I don't expect them to only use the Ovum report, but it's more of a, okay, this is what's been really pressing to her. I think this is what we need to touch on, but I need to make sure I touch on that. What I hope Ovum does is allows them to feel comfortable again listening to that intuition, because we are biologically trained to have an intuition, right? You listen to a lot of women's stories, and every woman has a story, is I knew something was wrong. I knew something was wrong, but I was told that it wasn't. And that was the same. I had that story, and every woman I've had on my podcast has that story. I think that what's happened is because women have been silenced in, I think not just in the healthcare system, in a lot of industries, being told, be quiet, don't speak up, you're wrong, you're hysterical, you're anxious. It's actually started to call self-doubt. Am I crazy? Like, am I right? Maybe I'm overthinking this. I should just be quiet. What I'm hoping is Ovum gives them that information, like you said, to say, actually, no, like, I'm validated. This is actually something I should bring up. It will give you the information that you can ask the question. And I think that's what I hope it does, is give women their voices back.
I think the other challenge too, and where I see this bridging a gap, is often we go to the wrong provider for the advice that we need. So I see this a lot in clinic, where patients will go and they will see their GP for something they should see their gynecologist for, or see their gynecologist for something they should see their endocrinologist for. To your point, everyone's operating in silos. Nobody's bridging the gaps and linking that together. And I think that is a challenge both from the medical system, because it's just the way that it is. And the woman walking out of her GP appointment going, I'm none the wiser, I haven't gotten answers. I have a lot of patients who will say, well, why won't my doctor run these tests for me? And I'll say, if you came to me and you asked me to run a test that was outside of women's health, sure, I can run it. It's not my specialty to help you in that area. So therefore, it's your doctor's job to help you. Again, it's the system. It's not anyone necessarily trying to do you a disservice, but it's more about having the right person or the right eyes on your situation. And I can see how this might actually help with that as well.
Yeah, so it does. And it does guide you on the right type of provider. In fact, from a clinical governance perspective, we've trained Ovum to always refer to the right allied health or the right GP or the right specialist. That's part of ensuring that women are not treating Ovum like a doctor, because it's not a doctor. It's there to give you the information. I always like to say it's almost like the doctor has a receptionist and this is your receptionist. It just gives you the information and helps you get where you need to go. What it will do, I guess, from an appointment perspective, if you do have an appointment of whatever kind, it will check in with you a day before and will help you prepare for that appointment. It will give you a list of questions. It may also say, well, you should ask for a referral to this specialist, because usually the primary care provider is the one that's giving the referral to that specialist. It can help you just get to that faster. And then it will also check in with you 2 hours after your appointment to make sure that you're uploading all of the documents. Usually you'll get a scribbly piece of paper from your doctor, so you can take a photo of that and it will read those scribbles and actually create a plan for you that you can enact, and it will help you set that all up in your app. You can do user-generated reminders anywhere, anytime about anything. So you can just ask the AI, I want a reminder about checking in to drink water 5 times a day, and it will do that for you. Or if you're intention setting with Ovum, so we can talk about the wellness side of what it does, it will help you plan about how in your day you can actually reach that intention. It will give you strategies, and you could set reminders to actually enact those throughout your day.
Changing gears slightly, you had an experience as a patient that opened up your eyes to this being something that was necessary. You were going to a medical appointment, you were trying to seek answers, and as the patient now, you saw a different side to that. I don't know what the right word is. There is this segment between patient and practitioner. I don't want to use the word arrogance, but it kind of feels as a patient a little bit arrogant.
I mean, do doctors have egos? I think there has to be like an element of it. It's like such a competitive and hard environment. Even if you go in with, not being egocentric or narcissistic, there's an element where to get through, you have to be. It is a bit like that. But I think you can do that with empathy and compassion. I think there is a patient-doctor relationship and there is this authority. And I think that's what you're feeling. Whether that's some doctors might have ego, some may be on more authoritative in their approach. This might be generalization. I don't think every single doctor you're going to have that. My integrative GP is incredible. The first time I saw her when I was dealing with the array of symptoms I was dealing with was just insane, because it ended up being a mixture of functional anxiety on top because I wasn't getting the treatment I needed. She spent 3 hours of me just talking and listening. So I don't want to say all doctors are like that, but in this setting, I think that there is an element of, you're told you're the top 1% of the 1%. You've worked really hard hard to get there, and there is a bit of God complex, and in specific specialties there can be as well more than others.
I feel like, sorry to cut you off, but I feel like if that was just slightly somehow, and I don't know how, because I get all of that, or even having these conversations and making practitioners aware of how they might come across.
Yes, I think
I think that's maybe the conversation. I think patients would be far more open and not like a deer in headlights. Like, I can't tell you the amount of women that I speak to. I'll say, did you ask X, Y, and Z? Yes. They'll say, no, I completely forgot. I just was like, it's the anxiety. Or the patient that will say, oh my goodness, my blood results are for, cortisol and whatever, which is nor here nor there.
I was like 3 times the upper limit.
Right. But that was only on that one day, because why? You hate going to the doctor and you hate having blood tests. I just like that we can have the conversation and shine a light on it.
Yeah.
And I think that if we could just have that, I think softening it slightly, and also but empowering women as well. Like, it's kind of like we have to meet in the middle somewhere.
Exactly. And that's what I talk about. I actually use this. This is like what Ovum's trying to do, is it's shared decision making, and we actually get taught about it in medical school. It's part of our kind of ethical approach to doing no harm, is autonomy. How can a patient have autonomy if there's a power imbalance? Ethics 101, right? The problem is then in the actual appointment, that's not always translated. I don't think doctors are there to do harm. They're really there to help. But whether that's the system, is what you talked about, is all burning down that emotional capacity, which is probably a large part of it, the administrative burden, especially in like primary care, the KPIs around actually they need to hit X amount of patients with X amount of time, that are affecting this, where doctors are maybe getting more blunt because they're running out of time or the emotional capacity is not there. And I talk about this as well in my podcast, is there's a language issue. And I remember one of the girls saying to me, she'd had a laparoscopic procedure for endo, and the surgeon had done a really horrendous job. Like, she was using a walking stick. She's 25. And she went and saw another specialist who's a female and looked at the imaging and was like, oh, wow, he butchered you. That is a really bad term for a 25-year-old girl who's just had her ovaries pinned to the walls. She's very open about this, by the way, so it's okay that I say it. I feel like that specialist probably didn't mean to hurt you in that way, but hearing that she said that, I was like, as a patient and now interviewing you in a different seat, that's just an example of doctors not thinking before they speak sometimes, which then creates a further power imbalance.
The challenge also is what the patient hears and what the doctor actually says sometimes
is very
different. I've seen this many times where I've questioned patients and I said, how did you get that conclusion? Oh, that's what the doctor said. And I'll look at the report and I'll say, that's not what any of this says. So again, you're anxious in an appointment. You've heard something that's maybe like, yes, but a version of what you were being told. There's a lot of variables that I think we don't necessarily consider. We're talking about women specifically at this point in time, but it applies across the board. No wonder that there's still this disconnect. It's just many layers.
And there's so many factors. Like, if we look at, I guess, if we talk now more broadly, gender health gap, the fact that women are spending 25% more time in poor health compared to men, so their health span, not lifespan, is shorter than men's. And the conditions that we're disproportionately suffering from compared to men is what contributing to that. So it's 47% of conditions that are not reproductive. It's like autoimmune, neurological, mental health, musculoskeletal, and 5% are reproductive and maternal. But it's mainly affecting us between 18 to 64 during our working years, which is then impacting the economy. So it's costing us $1 trillion annually. What is causing this is there's 3 aspects to it. There's the systemic biases, there's the interpersonal biases, and there's the research biases, which is what Ovum's trying to close, or at least deal with in some capacity, whether it will probably take decades to get there. What you're talking about is this interpersonal bias, but there's also an overlap, and it's always in a Venn diagram, right, with the systemic impacts or biases that then impact the interpersonal biases. And actually the research biases then also impact the interpersonal biases, because like how doctors are being trained, but it also impacts the systemic biases because our system's set up wrong, because we don't have good research on women. And it's these factors that are consistently interplaying with one another. But if you look at the World Economic Forum, and now working with McKinsey to track, it's called the Women's Health Tracking Platform, where they're looking at how we're closing each of these and the economic costs on it. It's really, really interesting. It's a very easy report. It's very visual. But for us at Ovum, when we're looking at impact, we're looking at what are we doing to address each of these 3 facets of the gender health gap.